Good evening, good morning, good night to our participants from different parts of the world. I'm happy to tell you that we have participants or registrants from at least 9 other countries, including Mali, Ghana, Ivory Coast, Cameroon, South Africa, UK, United States, Brazil, and Kuwait. So we have a lot of people that are registered for this conference today. So we'll get things going. And on behalf of the members of the Sickle Cell Support Society of Nigeria and the Nigerian Society for Haematology and Blood Transfusion, I welcome you all to this virtual conference, which was planned to mark the 2020 World Sickle Cell Day. I sincerely and deeply apologize for the technical failure which we had last Thursday, which precluded holding the webinar that we had planned for the 18th of June. Many of you joined us and waited for so long before the event was eventually canceled. This is the more reason why we felt compelled to reschedule the event as soon as possible. We really appreciate your presence with us today, and it is a testimony of your commitment to fighting the scourge of sickle cell disease. Let me start by recognizing my co-chairperson, Professor Aisha Gwazo, who is the president of the Nigerian Society for Haematology and Blood Transfusion, under whose auspices we function as a society. I thank our guest lecturer, Dr. Maureen Achebe, who is the director of the Sickle Cell Center and attending physician at Brigham and Women's Hospital, Harvard Medical School, Massachusetts, for honoring our invitation and for patiently waiting in her office last Thursday while we struggled to fix the technical issues. We look forward to hearing from her today on a very topical subject. The Federal Minister of Health was supposed to be represented today by the desk officer in the non-communicable diseases unit of the ministry in the person of Dr. Alaya Shokwekon. Unfortunately, we have just heard that he's ill and will not be able to present his paper. However, he has sent his slides, and Professor Unodu has kindly agreed to present his talk. Dr. Shokwekon has been very helpful to us over the years, and we would have loved to have him with us. I want to recognize and thank our trustees who have always readily given us their support and participated in all our functions. General Ogbonaya Njoku and Professor Abasego were in the audience last Thursday and have also joined us today. You are most welcome. I recognize another of our teachers who has also given us his full support always in the person of Professor Fola Esson. We are really privileged to have in our midst a person living with sickle cell disease who will share with us our experiences and challenges. People like her are the reason we do what we do, and it is always refreshing and beneficial to hear from them. Thank you, Architect Mariam Machina, for finding the time to be with us today. The Sickle Cell Support Society of Nigeria was registered as an NGO in 2013, and it evolved from the Nigerian Sickle Cell Disease Network, which was started in 2010. The society is open to all Nigerians with interest in sickle cell disease, either as patients, healthcare workers of different cadres, NGOs, and others. We are an umbrella organization that caters to all individuals and groups across the country. Our main objectives are advocacy, awareness, research, and capacity building. We are well represented in all the 6 geopolitical zones of the country, and currently we have research collaboration with more than 23 secondary and tertiary healthcare institutions in Nigeria. In terms of research, we have had far-reaching projects and scored some well-deserved international accolades. Just in the last 24 hours, one of the research papers that were produced from the collaboration in Nigeria has appeared in Lancet Haematology, and it's a groundbreaking and far-reaching work that is likely to revolutionize newborn screening for sickle cell disease in the third world. Professor Nondu is going to talk more about that in our presentation. Now, apart from internal collaborations, we have international affiliations within and outside Africa. Our major partner in the last 4 years has been the Sickle Pan-Africa Research Consortium, SPARCO, funded by the NIH, and is collaborating with us on many important projects. We have affiliations with several institutions in the UK, including Guy's and King's College Hospitals and Imperial College in London. In the United States, we have worked with researchers from Vanderbilt, Chicago, and Michigan universities, to mention a few. Sickle cell disease is an inherited genetic disease affecting the hemoglobin molecule, which is the pigment in red blood cells that carries oxygen around the body. When both parents carry the sickle cell trait, AS, they have a 25% chance of having a child with the disease, i.e. hemoglobin SS genotype. More than 300,000 affected babies are born every year in the world, and almost half of these are born in Nigeria. Thus, we have the highest burden of the disease, and although about 2% of newborns in Nigeria are affected, the prevalence rapidly falls to less than 1% in adults because 50 to 90% of the babies die before their 5th birthday, especially in the rural areas. Hemoglobin S causes deformation and rigidity of the red blood cells with recurrent blockage of blood vessels, leading to the painful crisis that is so common in the disease. The patients also have a chronic anemia. However, most tissues and organs of the body are affected as the patient gets older. The main causes of death in the children are overwhelming bacterial infections, malaria, severe anemia, and acute chest syndrome. They are also prone to stroke and other debilitating complications. I should remind our patients and healthcare workers that sickle cell disease patients are at high risk for COVID-19, and there have indeed been reports of patients getting infected. The infection makes the symptoms and complications of sickle cell disease much worse. Everyone, patients and healthcare workers, should be on alert at this time of the pandemic. The main management interventions that have been proven to prolong survival and improve quality of life of patients with sickle cell disease include early diagnosis, preferably in the newborn period, and comprehensive care in a dedicated sickle cell disease clinic. Attention is paid to nutrition, immunization, health education, and surveillance. Also of utmost importance is prophylaxis against pneumococcal infection using penicillin and against malaria. More than anything else, sickle cell disease has to be considered as a public health issue, and community/primary care is paramount since most of our patients do not have access to secondary or tertiary care. There have been exciting developments in drug and potentially curative therapies for sickle cell disease in the last few decades, and more so in the last 2 to 3 years. Hydroxyurea was the first drug to be licensed for use in adults and children. It reduces the frequency of crisis and anemia and acute chest syndrome. It has really improved the quality of life of patients. Unfortunately, it is grossly underutilized in Nigeria. Whereas in the United States, the drug is now offered to patients as young as 9 months of age, irrespective of their clinical course. 3 newer drugs have just been licensed. These are L-glutamine, voxelotor, and crizanlizumab. They have all shown promise in clinical trials, and more experience is being gathered on their efficacy. Being a genetic disease, however, The only cure for sickle cell disease is to replace or change the abnormal S gene. One strategy is stem cell transplantation, usually using bone marrow from an unaffected tissue-matched sibling. There are many problems associated with the procedure, and it is manpower and technology intensive. The other strategy is genetic engineering. Although sickle cell disease has been described as the first molecular disease, the process of producing successful gene therapy has been very slow until recently with the advent of gene editing, which has shown so much promise. Reports of its success in some sickle cell disease and thalassemia patients have appeared in the literature in the last 2 years.
I didn't know that.
The theme of our conference is reducing the burden of sickle cell disease in Nigeria, and the presentations have been tailored to address the different aspects that I have just alluded to.
Picture here, yeah, right.
The talk from Dr. Alayo would mention government policies and partnerships, while the guest lecture will be on gene editing. Professor Nodu will talk about Sparkle projects, especially newborn screening using point-of-care devices. She has very exciting accomplishments to share with us. Then we shall have a mini symposium on hydroxyurea with 4 speakers sharing their experiences of different parts of Nigeria. One of our very senior colleagues, Professor Angela Okolo, will give us a report. Just a minute. Some people, please mute your microphones so that we don't have disturbance. One of our very senior colleagues, Professor Okolo, will give us a report from our South-South zone. Indeed, if not for the pandemic, we were going to have this conference physically in Asaba. Professor Chide Okocha will address the issue of community involvement in the management and control of sickle cell disease. Professors Opala and Bazuaye will talk on newer therapeutic agents and bone marrow transplantation, respectively. We have 2 industry representatives who will be making presentations. One represents the manufacturer of hydroxyurea in Nigeria, while we shall also listen to a presentation on another point-of-care testing device. We shall have a questions and answer session towards the end, and a communique will be presented at the end of the conference. It is my hope that we shall all gain from the presentations today. We should be able to learn more about the therapies, and hopefully doctors and patients will feel more comfortable using hydroxyurea. We would also have been enlightened about the good work going on in different parts of Nigeria. We are really proud of the contributions of our society and others working in different spheres within the country towards enabling the health and quality of life of sickle cell disease patients. However, there's need to do a lot more. We call on government to make the passing of a national policy on the management and control of sickle cell disease a priority. We appreciate the state governments who are making newborn screening a priority and giving attention to sickle cell disease overall. Nigeria really has to be in the forefront of combating the disease. Our people deserve no less. Thank you for your attention, and please sit back in the comfort of your home or office and enjoy the next 2 to 3 hours with us. For those who want to contact us, we shall be displaying our website address. Please feel free to visit and fill the forms for membership of the society. Please remain safe wherever you are. COVID-19 is real. Thank you so much. My name is Adekunle Adekile. I'm not sure I introduced myself at the beginning, and I'm the chairman of the Sickle Cell Support Society of Nigeria. Thank you very much.